Hello, good morning. Good morning, everybody. It's Auntie 𝗃𝗧𝗏 again. Yeah, good morning, good morning. So today is 29th of May. Yes, 29th of May. Yes, hope to see more of our friends here. Okay. Yeah. Today is with Dr. Ronald Lim. Yeah. He's actually a specialist. I'm happy to get him with me today. Yeah. So any of my friends that come in, say hi to me. Say hi to Auntie 𝗃𝗧𝗏 so that I know you are with me. Yes. Good morning, Catherine. Yeah. So whoever is down here, say hi, Margaret. Hi, Margaret. Yeah. Thank you for supporting Auntie 𝗃𝗏𝗏. See, say hello, 𝗔𝘀𝘁𝗿. Good morning. Wow, so nice to see all my friends are still with me. Yeah, in fact, I mean, this situation nowadays is getting worse, like the COVID now. So my friends, have you registered? So this is a question that everybody is asking. Have you registered? And have you got your registration done? Okay. So this is a time that everybody will ask a question. And how is the situation as we can see now is actually not so good, right? 𝐷𝐴𝐻, morning 𝐷𝐴𝐻. You see now it's from 6,000 plus to 7,000, 7,002, 7,002 to 7,008. Now it's 8,002. So now you see, government already announced there will be a total lockdown again. Good morning, Pauline. So from 1st June to 14th June, it's just same like our last year. So we hope that by this time, when injection is done, we hope everything will be fine. We really hope so. Yeah. So what do you think? So all my friends, have you got the registration done? Yes? Say a yes to me. Yeah. And then I think maybe we have done, but then maybe... Good morning, Jancy. Jancy, good morning. Yes, 谢谢你啊, Jancy. Yeah, every time I can see all of you are always with Auntie 𝗃𝗧𝗏𝗏. Because Auntie 𝗃𝗃𝗏𝗏 today is the consider the 29th of May is the 1 year, you know, actually the 1 whole year of Auntie 𝗃𝗃𝗏𝗏. Yeah. Yeah. Hello, Jing, yes, Jancy, yes. Good morning, Jade, good morning. So that means all of you have done your registration. And I say Auntie 𝗃𝗃𝗏𝗏 is actually it's 1 year anniversary actually. And this is the anniversary that I'm able to get a doctor, because last time I started was during COVID pandemic time. So it's still during this time, it's still pandemic time. So in fact, it's we really need to pray. Yeah, Margaret, as you say, we really have to pray hard, get the vaccine. It won't kill, but then accordingly, we don't know. We ask the doctor later. It says that maybe the vaccine, the valid is only for half a year. I'm not sure. So get ready, my friends. Get ready. Yeah, Joanne, get ready. Whatever question that you need to ask the doctor, please write down. This is the right opportunity. Okay. So without further ado, I would like to. Jennifer, you have no news yet. Yeah, they say you have to keep on checking your Mysadatra. And then Johor, it seems that Sultan is doing something that he will try to get a vaccine for his people, that means us, early. Okay. Okay, so now I shall start to get Dr. Ronald. Okay, Dr. Ronald. So we will invite Dr. Ronald. So my friends, if there's any question, please stand by your question to ask Dr. Ronald. Okay? Yeah, May Wong, good morning. So now I shall invite Dr. Ronald to be with us. Hello.
So good morning. Hello, good morning, everyone. Thanks for inviting today. I'm Dr. Ronald Lim, respiratory consultant of Regency Hospital. So today we're going to talk about a hot topic that has been broadly discussed recently. Can you see me? Can you see my slide?
Yeah, I can see you very well. Yeah, doctor.
Okay, so today we're going to talk about a hot topic that has been broadly discussed recently: the COVID-19 vaccines, whether to jab or not to jab.
Yes, we are so confused. Auntie are so confused.
So since the first identifications and a direct sequencing of the gene sequence of COVID-19 virus it's been 70 months elapsed, but actually this notorious virus is still torturing us and torturing the whole world.
Yeah.
As you can see, last year we are just at the infant phase of understanding these diseases, and we have been using quite a lot of medications, trying our best to treat this disease. As you can see on the left of the top, hydroxychloroquine, an immunomodulator that has been used to treat the some autoimmune disease like systemic lupus erythematosus. But unfortunately, it was proven to be a negative trial, which means it has no any significant impact on it. On the right of the top, antibiotics. We use a very commonly used antibiotic, azithromycin. But this azithromycin is not only acting as an antibiotics, but it's also an immunomodulator. But as you can see, again, both curves overlap together. If they overlap together, meaning that there are no significant difference in between them. Only those curves that has been split or separated, meaning there's a significant difference. On the left lower, heart. What is heart? Heart is a medication to treat a special virus named HIV, the HIV virus. Again, it's a very disappointing result. And on the right, we use ivermectin. Ivermectin is an anti-parasitic agent. Again, both curves overlapping together, showing this is a negative trial. Loose, non-significant.
Yeah.
So on the second, sorry?
Yeah, doctor. So now you're talking about the vaccine they're trying to use or something like that, right?
Yes. So this is the story that I need to go through first.
Yeah.
Secondly, they have tried on some vitamins D and some high dose vitamin C or zinc to treat COVID. Some even advise us to drink every day, drinking the lemon water with lemon or vitamin C. But unfortunately, proven to be a negative trial. So lose again. Yet, though we are having that much of disappointing results, but we are some encouraging results as well. Left of the top, remdesivir, one of the most well-known antiviral agents for Ebola virus, has been proven to show its efficacy while treating the early phase of COVID-19. On the top of the right upper is the remdesivir with baricitinib, an interleukin-6 inhibitor. This also show a very convincing result in those patients with severe COVID pneumonia. Left of the bottom, dexamethasone, a steroid. So steroids, they have shown a significant improvement in the overall survivals for those patients with very bad COVID because it is able to reduce the inflammations. And on the right bottom, tocilizumab, an injection type of interleukin-6 inhibitor, which is also show a survival benefits. So these are the encouraging results that we have gone throughout these 17 months. But yet, from the point of a doctor, prevention is always much better than treating or curing the patients. So throughout these 17 months, we have been wearing masks, and we have been keeping a social distancing, and even until we are having some social phobia, we are doing a frequent hand hygiene. But yet, is there any other ways of preventing this illness? So before we go into the vaccine, let us have some cartoon. So I'm sure every one of you have such experience.
Yeah. You see, doctor, for me, it's only I can see you, but I cannot see the slide that you are putting, you see.
You cannot see the slide?
Yeah. Because...
I'm sharing the slide already, share screen.
Yeah, I can't because this is not Zoom, you know, this is a stream, so I can't see the one that you are sharing. It's only you and me, that's it on the screen. Yeah. I see.
So can you see the screen now?
So never mind, we just by verbal and you just talk it simple, Auntie understand. Yeah, just talk it to layman.
Sorry, can you see my share screen?
I can't see because Yeah, doctor, I can't see. Yeah.
I've been sharing already.
Yeah,
Can anyone see my slides?
No, I can't because no, this is not Zoom. Actually, this is what do you call that? This is okay. Unless I put you the other one with the share. If in this case, then I can see if you put out now. Yeah. You see now it's on your laptop, right? Yeah.
Cool. I didn't know that. Can't see. Sorry for that.
It's okay. So you have to. We are trying. Yes. Thank you very much that you prepared all this. Yeah.
Can you see me?
I cannot see your detail. I can see only your laptop. You see, yeah. Your main screen on the desktop. Yeah.
Now can you see?
Yeah. Now can see. Yes.
Can you see my slide now?
Yeah. It's a small ant. So many ants.
Yeah. So many ants over there, right? Okay, good. So can you see all those ants and candies?
Yeah.
Okay. So this is the concept of immunity. I'm sure every one of you have such experience. When there are some candies drop on the floor, it's going to recruit quite a lot and quite a numbers of ants. Not only the ants that is nearest to the candy, but these ants will try to recruit those ants which is far away. Then eventually, you can see the pictures on the right lower is that all these ants will be carrying all these candies away from the scene and back to where they stay, right? So this is the same. This is the same as our immunity. So while receiving all this vaccine, actually we are introducing an antigen into our body, meaning that this is the candies. And we're going to cause and induce our immunity, which is the ant. And at the end, we're going to produce a lot of the ant army. And next time, if there's any virus came into our body, all this army will go and destroy that virus. So eventually, when there's a new virus coming in, all these immune will be recruited and to destroy the virus. So this is the concept of immunity. So this is a time sequence of vaccines development. Why they are so why our nations is not that very confident in this COVID vaccine it is because it developed too fast at a very fast track.
Yeah.
The traditional development actually for a vaccine, it needs to take years to even 15 years. We have to go through all those basic bench study. Then we have to go through phase 1, phase 2, phase 3 study that eventually it's been marketed. But for our SARS-CoV-2 vaccine development, because we are having the pandemic since 2020 or since the end of 2019, so all of it has been used under an emergency authorizations. So as you can see, we only took 10 months or 1 year to market all this vaccine. So the consent that you have, I'm sure that this is normal. This is normal. Okay. So let us have a look on the types of immunity that we have. So on the graph on A, this is a natural infection. As you know, we inhale the COVID viral particles into our upper airway. So it starts to replicate on the upper airway. And at that time, it will develop quite a lot of what we call the secretory IgA, a type of antibody. But eventually, this virus will go deeper into our lung and our body will develop an IgG antibody. So actually, a very good protections will be having a secretory IgA and IgG. But those vaccines that we're going to receive is through injections. So through injections, we only develop the IgG antibody. On C, we have a look. We have a different types of vaccine, which is been delivered intranasally, meaning that we only need to inhale the vaccines. But on these modes of vaccine, we develop IgA, but there's no IgG. So actually, from my point of view, it's better to develop both. Why? Because we can stop the virus of transferring from the upper to the lower lung. So this is the notorious SARS-CoV-2 virus. and you can see the spike that that occur outside the virus. This is what we call the spike protein, and this is the most antigenic part of this virus. And remember, the candies and the N, this is the candy. All this spike is the candy, meaning that the vaccines that we have been injecting, actually we are introducing this spike into our body to induce our immunity. So far, is it okay for everyone?
Yeah, maybe it's quite technical, but we slowly we will try to understand, because this is something new for the auntie. It's very we are just a layman, but
it's okay. It's okay.
Yeah.
So far, is it okay for everyone?
Yeah, I think should be okay. Okay, right, and okay, so that doctor can continue. I think should be okay in a way. Yeah.
Okay. So I would like to discuss 5 types of vaccines that we currently have, and then the several types of vaccines that we are currently having in our country. So the first is live attenuated. So live attenuated vaccine is a weakened vaccines, which is we are injecting the weakened virus into our body, which is going to cause some limited disease, but because it is a weakened living, it's a live living virus, so it can cause a very, very strong and persistent immunity in our body. Just now, Auntie Boleh said that some vaccines can only last for 6 months, right? Yeah, but this type of vaccines can last for even longer. But there are lots of safety issue on preparing these types of vaccine. So I'm regret to tell that currently none of these types of vaccine has been put into a clinical trial, not even a phase 1 study. So let us forget about it.
Yeah.
Secondly, inactivated. As the name implies, inactivated, meaning that we kill all this virus. We introduce a kill virus into our body. I mean, in the simple term, it is therefore more stable, less expensive. But as you know, all this virus has been killed, so they have the immune memory that has been induced by these types of vaccine will be in a shorter durations. So far we have 4 in phase 3 study, and one of it is very, very, very well known because it is called Sinovac. Because Sinovac is the second vaccines that we have in Malaysia. So as the table shows, the second is a Beijing, and the third is a Wuhan Institute of Biological Products, and the fourth is a Covaxin from India. So recently, the study that has been published a month ago, showing that the second and the third Beijing and Wuhan vaccine, their vaccine efficacy reaches 78 to 80%. So which is a very good vaccine as well. So SARS-CoV-2 protein vaccine is just introduced the spike protein directly into our body. It can be prepared in a very low cost, and currently there are more than 16 pharmaceutical companies doing this, but not widely being accepted, so we are still awaiting for their good results. Okay, so we are still waiting for their good result. As you can see, more than 16, but only 2 in phase 3. One of the well-known is the lower one, called VLP, viral-like protein, but still under investigation. So we hope that in the coming 2 to 3 months, we're gonna have reporting of the result, whether it is good enough to protect us from getting COVID. The fourth, messenger RNA, the brand new stars of the COVID vaccine, and an important breakthrough of the vaccination's history. So this is a new technique Actually, it is new in COVID, but actually it is not for Ebola, because actually this technique has been developed for developing Ebola virus. So it's just to put in the messenger RNA of the spike protein into our body. And this messenger RNA, it will be produced into the spike protein, and this spike protein will going to induce the immunity inside our body. So it has a relatively high safety profile. It has a relatively high safety profile because it is more specific. But as you know, those things that is more specific, meaning that it cannot cover a broad spectrum. So it might not be very effective in covering or protecting those mutated strain of this virus. So actually there are quite a numbers of vaccines under investigations, but I'm sure all of you know about Moderna and Pfizer. So Pfizer is the first vaccine that came into Malaysia, which need 2 doses with 3 weeks apart. And Moderna is the same as well, 4 weeks apart, but needs two shots. So both of them able to provide a 94 to a 95% of protections against this virus and these diseases. The last one, the viral vectors. Viral vector, I'm sure everyone know this because of AstraZeneca. So they are using the chimpanzee adenovirus, incorporating with the spike protein, sending into our body. So because of the presence of this chimpanzee adenovirus, it might also induce some immunity inside our body. So there are 4 types of viral vectors: CanSino, Sputnik 5 in Russia, Johnson in United States, and one of the well-known is AZ from the United Kingdom. So there are different types of viral vectors came up with different safety profile, and one of it will be AZ. So most of us will be very concerned on the thrombosis event that is brought by AZ. But actually, the thrombosis events that brought by this vaccine is more commonly to happens in those patients or in those populations from the Western country. But we, as an Asians, we rarely develop thrombosis, because for Caucasians, they are more easily to develop clots as compared to us Asians. We Asians is more prone to bleeding. This is the difference in the genetics. So there are 3 well-known vaccines that we have. So I would like to do a slightly comparison. Messenger RNA, the Pfizer, Moderna. The vector is the AZ, Sputnik 5 or CanSino, or the inactivated one, the Sinovac. Let us have a look on the challenges. We have to know that the messenger RNA, because RNA is relatively unstable, so it needs a very low temperature to store. Moreover, it is quite a new technique in the vaccine history. Therefore, quite a numbers of people is not very confident in this technique. Second is the vector. Actually, the viral vector vaccines, they have a very complicated process. So the safety issue is the main concern. But for inactivated vaccine, what we are concerned the most and the challenge that we meet the most will be the high cost. So let us have a look. The efficacy of all this vaccine. As you can see, the first 3 is inactivated vaccine. The 4th and the 5th are messenger RNA, and the lower 4 will be the viral vector vaccine. So you can see the efficacy of vaccine highest in the messenger RNA vaccine. Pfizer 95, Moderna 94.5. But yet, because they are a they are a messenger RNA vaccine, they need a lower temperature to store it to prevent the denatures of all these messenger RNA. So for the inactivated vaccine, actually they have a protection rate of 65 to 79%, meaning that they are good. They are very good as well, very good as well. And for the viral vector, it ranges from 63 to 91% of protection. So who can receive? Who cannot? So let us have a look on this table. So for Pfizer, actually it has been doing a study for those patients younger than 16. So currently the FDA has approved those patients from above 12 years old are able to receive a Pfizer vaccine. But for Moderna and AZ, still have to be older than 80 years old. Why 80 years old? This is because all our phase 3, phase 2 clinical study, we need to send for an ethical review. So only patients that is only adults, most of the time only adults are able to be enrolled. Is there any maximum age requirement? Actually, none. Because I've been receiving a lot of phone call from my patient telling me that is it possible for their parents, who is 80 to 90 to receive? The answer is yes, able. So for pregnant lady, the answer is yes as well. Why? According to the American College of Obstetricians and Gynecology, those pregnant lady who being infected by COVID, being infected by this virus will have a very severe form of COVID, and it carries a high risk of preterm labor ranging from 36% to 60%. So for those pregnant, we are encouraging them to receive the vaccinations as well. How about breastfeeding? The answer is yes as well. For those patients with immune compromise, what means by immune compromise? For those patients who is having cancer, who is having autoimmune disease like rheumatoid arthritis, systemic lupus erythematosus, because they are receiving all kinds of immunosuppressant, the answer is yes as well. For HIV patients, the answer is yes as well to receive the vaccinations. So for those who have been previously infected by SARS-CoV-2 virus, are they able to receive the vaccine? The answer is yes. They may be able to postpone several weeks to months to receive this, because once they get infected, actually there will be an antibody developed inside the body, will keep them being protected for 3 to 4 months. Okay, so who is the contraindications for receiving all this vaccine? Who cannot receive? Those patients to have a very bad allergy reactions to the content of this vaccine, they are not encouraged to receive. Meaning that if you are having a very bad allergy to all kinds of foods or medications, you have to think twice before you are taking the decisions of receiving all these vaccinations. So actually, all of this development of the vaccines, we need to evaluate its long-term efficacy, which is probably 2 to 3 years of study periods. But as I stated just now, we are having a global pandemic of these virus infections. Therefore, quite a numbers of all these vaccines has been marketed under the regulations of emergent authorized usage, meaning that they haven't completed the whole study, but because of the needs of the world, they have to release the study result yet. So all those vaccine efficacy that we seen just now will be based on the cutoff point that the study being underwent. Meaning that if it is a cutoff point at 3 months, meaning that the protections truly is only 3 months. How about 6? How about 9? How about 12? So we have to wait the updates results from all these pharmaceutical company. So a long-term efficacy, we are still unknown whether we need to have a booster shot or not, we are still not certain with it. But I can truly tell you that vaccination, it is able to reduce the severity of getting the COVID. Once touch wood, you having a less serious or mild disease only instead of progressing to the severe form of COVID. There's no arm-to-arm study comparison which one is better. So if you try to ask me, doctor, which one is better? I'm sorry that I can't tell because there's no arm-to-arm study comparing them together. Fourth, we are more concerned about the mutant strain. Remember the strain that came from UK, from India, which is very and highly contagious with an R0 of very high. So most of it can't be suppressed or being protected by the vaccines we have now. The herd immunity. And the other is social distancing, mask, and hand hygiene. We are at a very difficult moments. All this study being done while all these study candidate having a physical barrier. But throughout our vaccine history and all this study, actually, they are not doing the study under a physical barrier. So my question is, after vaccinations, can you remove your mask? The answer is no. The answer is no, because all of these studies, all those vaccines efficacy that you've seen just now, that I show you just now, all these studies are being done under physical barrier, meaning that they are having social distancing, they are wearing masks, they are having hand hygiene. But we do not know what is going to happen if you are not having social distancing, you are not wearing a mask, and you are not doing a hand hygiene very routinely or very regularly. So vaccine, after receiving vaccinations, you still need to keep a physical barrier from the virus. Okay, and not all scientific. Yes.
Yeah, doctor. Can we just answer one or two questions from the viewers here, right? So some they're asking, say like Li Jin is asking, I'm curious about why the interval between the two jabs differ from the different vaccines available.
Okay, this is due to because we are introducing difference of antigens into our body in a different way. So meaning that you are introducing the antigen in a different way to the body, the immune systems that going to develop will be different as well. So some might only need one shot, some may need two, some may be 3 weeks apart, some may be 8 weeks apart. This is due to the delivering of the antigen into our body. This is according to the design of that vaccine. Yeah.
Yeah, thank you, doctor. Yeah, okay, so that's different. So another of my friends says that he said vector, that means you can use other than chimpanzee or from pig. There are rumors, okay, just rumors. Some of this Muslim is worried that this vector for 𝐷𝐸𝐵, they say he's using from pigs or something like that. So they are worried about this. Is there any scientific proven or something like that?
Actually, 𝐷𝐸𝐴 is using chimpanzee, not a pig. So I think the source of the information might be wrong. It's using a chimpanzee. Chimpanzee. So it is not what the so-called pig. No. So there's no it is halal it's halal.
So it's halal.
Yeah. So I think the information that you get is wrong. So it is, as I stated just now, the slide, it is a chimpanzee. Sorry, it's over here. You see 𝐷𝐸𝐴, chimpanzee adenovirus. Okay, chimpanzee adenovirus. Yeah.
Yeah. Again, yeah, doctor. You see, some of the senior members are they are all they have a favor towards Sinovac. Okay, so they are sometimes they say, oh, Pfizer, I don't want 𝐷𝐸𝐴. They just want Sinovac. Is it because of what do you call that? belong to China, they feel safer or something like that. I'm not sure why are they older people that prefer Sinovac?
Okay, so Sinovac is an inactivated vaccine. So this technique is a very mature technique in the vaccination history. Okay, it's a very mature technique in the vaccine history. So this is one, the technique is very convincing. Secondly, is the protections, because it's able to protect 70 to 80% of the vaccinated people. So I think both of these are encouraging. Why the Pfizer is a concern? Because it is a very new technique. It's a very new technique. So I'm sure why there's a saying that older people are receiving Sinovac. I think because due to the maturity of the techniques and also a good efficacy of this vaccine. But to be honest, as this slide implies, the bottom, not all size fits one.
Yeah.
It doesn't mean that this kind of vaccines will be truly will be that suitable for this individual. That is why we are from a doctor's point of view, we need to develop more vaccines with different routes. Remember the early in the slide which I said inhaling one. Yeah, because through this we can only induce a full protections of our body. So there's not all size fits one. There's no a single vaccines that will be good for everyone. Yeah, good for everyone. This is also the same for polio virus. Polio virus, some countries using the nasal one, some using or the oral one. It depends on the incidence on that country. So for me, to be honest, when you're asking me whether to jab or not to jab, we have no choice to change. We have no chance to choose, and we are having the pandemic and see the growing cases in Malaysia every day, increasing every day. So once you have the chance, once you have the appointment to go for the jab, my opinion is go for it. Why? I'm sure that it will bring us the benefit, but I'm sure there will be disadvantages as well, meaning that there's benefits and there's risks. If the risk is much lower than the benefits, the risk is lower than the benefits, I'm sure that it is worth doing that. It is worth doing that because my experience, once I take care of one COVID patient, thereafter I try to tell myself better not to take care of the other because it is really bad. COVID patients, once you get it, it is very bad. So this is my advice to everyone. Only if that you are having a lot of allergies to all kind of foods or medications, then you need to think twice and you have to be very cautious with it. Otherwise, I really do I do advise, because we have been doing those SOP for the past 17 months, but we are still being tortured by this virus.
Yeah, doctor, there's a friend, Joanna, she's asking, allergic to penicillin. So is it okay to go with 𝐷𝐸𝐵?
What type of allergy that you have with penicillin? Is it a mild only as some skin rash, or it is a anaphylaxis? Maybe you need to be intubated. So what kind and how severe it is, the allergy to the medications? Have to be very specific. If it is mild, you can think twice. But if it is a severe allergy, we better not to receive any kinds of vaccinations.
Yeah. Any kind, meaning that means she can't take even Pfizer or whatever?
Yes, because you won't know all these are allergic reactions. For those patients who have a severe form of allergy, you have to be very cautious and you need to be very clear to you need to declare to the doctors that in charge of the vaccines, because during the day that you go to the center to receive the vaccine, there will be a doctor counseling you. Then you need to tell him, you need to declare that which types of allergy you have. For those who have a very severe form of allergy, I will advise not to. But for those only very mild allergy, you can receive it very cautionly, very cautionly. Yeah.
Yeah.
Let me share with you my experience. I've been practicing in Taipei for the past 20 years. So I have some colleagues over there, and to my knowledge, they are using the AZ vaccine. So one of my colleague, the head of nurse in the pediatric wards, actually she has quite a number. So she have quite she has allergy to quite a numbers of medication and food, but yet she decided to take the vaccines even though we asked her not to. Even though we asked her not to, she took the first jab, and she developed anaphylaxis in 5 minutes. In 5 minutes. So because he's our hospital staff, so we just send her to the ICU for a close monitoring for 24 hours, and she was discharged smoothly. But the whole hospital, all those ID consultant, respiratory consultant, we have a meeting for her, and we are not going to give her the second shots, which is 8 to 12 weeks apart. This is what happened in my colleagues in Taipei. So for those having a lots of allergy to all kinds of medicine or food, you really have to be very cautious with the vaccination. I think that is not only AZ. I think all kind of vaccines carry the same risk as well. So you have to be very cautious and think twice before receiving. Yeah. This is one of the experience I have in the past 6 weeks. In the past 6 weeks, yeah. But actually, she's doing good lah. She's doing good currently.
So, doctor, actually the side effect is not because of the vaccines that we are having. Is that the individual person what they have within them that may have side effect? It's not because of the vaccines. Is it something like that?
I'm sure the side effects is brought by the vaccines, but it's only the matter of severity. The matter of severity. If it is mild, and I'm sure that everyone is acceptable. For example, fatigue. You are feeling weak, fatigue, or a little bit of fever. I think everyone can accept, right? But if it will cause you shortness of breath, it will cause a very bad thrombus in your body, causing myocardial infarction. I don't think this is acceptable lah. So I think the side effects will be random, but it's only that how severe it developed inside your body. For me, I also have the side effect while receiving the Pfizer. My first dose was on 18th of March, and my hand was very painful. I just can't raise my hand for 3 to 4 days, and feeling some lethargic. Then it resolved spontaneously. After the second shot on 8th of April, I do not have any injection site discomfort, but I developed a very fatigue for I think 10 to 14 hours. Then eventually I'm okay. So this is the minor side effects of the vaccine, which I think is bearable. It is acceptable. So for me, it depends on how severe and how bad the side effect happens on you. Yeah. There are some of our colleagues develop high spiking fever up to 39.3. Yeah, same. Pfizer. Yeah. So it depends. Really, it depends. Whether to jab or not to jab, at which timing actually is always your it's always your choice lah. So it's only the matter that how bad it will develop inside your body, because no one's know. No one's know. Therefore, for all patients receiving the vaccinations, you need to stay at least 15 to 30 minutes inside the injection center for monitoring. You can only leave the injection center when there's no any side effect developed in the 30 minutes or 15 minutes. Yeah.
Doctor, let's say for example, you see, I have the jab on the 20th of May. I had got the Sinovac jab. So actually, after that, till now it's about 9 days, but I don't feel anything at all. No.
That's good. That's good.
So we won't know. Let's say anybody lah. Let's say we won't know the second jab. What side effect will they cause? Actually, we won't know, right? Yeah.
Most of the time, the second jab, because inducing more immunity, the side effect will be slightly higher for most of the patients, but it's not true for everyone. But you can know that the second jab, it will induce a higher immunity because you have been given once already. The second dose is just like a booster. So the immunity being raised, being induced, if it is higher, for sure, the individual is going to develop he can feel it more vividly. He can have more side effects, but not everyone, okay? Not everyone, because there are some of our colleagues or patients after vaccinations, just like injecting the normal saline into the body, nothing happened. Nothing happened. Yes, so it depends. It's always your choice, but you need to evaluate. You need to assess yourself whether is it the benefit outweigh the risk. If it is, go for it. Go for it.
Yeah. So it's also a good news that so the news coming out that the government will appoint few more private hospital for the vaccines, become the vaccine center. So how do you find it? I mean, what do you going to say about this? Yeah.
Actually, all these vaccines has been booked and ordered by our government. So being jabbed in the private sectors is just that the private sector help to provide the vaccinations to the nations, to the populations nearby the hospital, to increase the vaccinations rate in the whole Malaysia. Actually, we are just helping the government to do so instead of we buying the vaccine by ourselves. Yeah, this is a good policy. This is a good policy, because by increasing the rates of vaccinations, I'm sure there will come what we call the herd immunity. Because fighting COVID is not only the hospital, it's not only the responsibilities of hospital doctors or nurse. It's all of us. We have to do it together. We can only success if we do it together, if we work together. Yeah.
Okay. Yeah. So my friends, if there's any final question to ask the doctor, yeah, it's about time. So fast, be fast. Do you have any question to ask the doctor? Yeah. So that means, doctor, the final question. So how are we now to protect ourselves against the COVID-19, as what you said just now? Hand sanitizer, SOP, we still need to follow as what you says just now, right? Yeah.
Yes. Yeah, I need to emphasize and inform once again, all of the COVID vaccine studies has been done under a physical barrier status. So please not to try to violate the SOP even you are after you receive the vaccinations, because patients vaccinated but not doing social distancing, not wearing masks, and not having hand hygiene. As I told you, only you choose the right candidates that has been designed by the study, then only you obtain the results of the study. This is an evaluation and assessments from a doctor. So never think that you are like the Iron Man after receiving the vaccination. Please comply to all these SOP. Yeah. Okay. Yeah. Please.
Okay, the last question. You say, is regency open for the COVID-19? Let's say if people, they want to apply to regency, or still they have to apply to MySejahtera?
Yes. We still haven't received any information from the government yet, but to my knowledge, there are 4 private hospitals in Johor has been assigned by the government to deliver the vaccinations. I hope that one will be regency, yeah, so that we can serve everyone. Yeah. So if there's any news, if there's any update, we can share together. But you have to see the news that has been announced by the government as well, because I'm sure that the Johor government will release if there's any, if it is being confirmed, Yeah, if it is being confirmed.
Thank you very much, doctor. Yeah, thank you very much today for sharing with Auntie 𝐷𝐴 and my supporter and the viewer. Yeah. So any last word, doctor, you like to say to the viewers? I mean,
stay safe.
Stay safe. Yes.
Yeah.
Thank you very much,
even though since year 2020, positive is most negative words for us, but keep your mind positive. that will do. Okay, keep your mind positive will do. Keep other tests
Yes,
negative.
okay.
Okay, please. Okay, stay safe.
Okay.
Bye bye.
Thank you. Bye bye, doctor. Thank you. Thank you. Yes. Wow, awesome to have Dr. Tan, Ronald Lim with us. Yeah, Ronald Lim from Regency. So I think we are all clear. Not 100% clear, but at least we come to a point that we understand a little bit more. Yes, thank you. Thank you. Yeah, Joanne, you say it's a very informative. We want to say thank you to Dr. Lim, in fact. So I hope everybody stays safe. Lah. So take care of ourselves. And it's accordingly. Lah. Let's say they say putting mask, right? They say you put mask, just a demo. Lah. Okay. Say a mask, you put mask. They say this is a 50% you cover. Okay. But according to TB8, say if you put one more layer, 2 layer, it helps to achieve 85%. So if possible, we put on a double mask if we go out. Okay. So everybody, thank you for being with Auntie Boleh today. Okay. So Auntie Boleh loves to share. You all help me to share. In fact, it's a really awesome mix today. Okay, thank you, everybody. Okay, 5, 4, 3, 2, 1. Thank you, everybody. Thank you. Bye-bye. Stay safe. Stay safe. Bye.